I'm not
Hi,
looking.
Steve.
Hi, John. I see ya. Well, my little clock says 10 o'clock, so we'll start the meeting. The meeting will be in person via WebEx, video phone conference, and streamed live on the internet. Not more than 2 county commissioners will be present in the meeting room. The public may join the meeting via WebEx in person at the meeting room or watch the live stream. If joining the meeting in person, the total number of persons, including commissioners, cannot exceed 10, and social distancing at least 6 feet will be in effect. The governor of the state of Minnesota has issued Executive Order 20-01 declaring a peacetime emergency and coordinating Minnesota's strategy to protect Minnesotans from COVID-19. On March 24th, 2020, the Pine County Board of Commissioners declared a local emergency for Pine County. Based on these conditions, the chair of the Pine County Board of Commissioners has determined that the requirements for Minnesota Statute 13D-021 Subdivision 1 have been met, and it is not practical or prudent for all members of the county board to meet in person. The public is invited to join the meeting in person or remotely by phone, and the information is given. So given all that information, we'll call the meeting to order and we'll rise for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Everybody, is there anybody here that wishes to speak at public forum?
Commissioner Holland, there is nobody present in the public meeting room other than
Okay.
Commissioner Mikrot, myself, and Ryan.
I'm not seeing any call-in people that I do not recognize, so we will move on to adopting the agenda. And I know there are some additions.
Mr. Chair, we have 3 additions. If we could add to the consent agenda item number 4, new hire for Human Resources Generalist Jessica Blesner. If we could add additional information for regular agenda item number 7, awarding of highway contract number 2001. So there's actual bid information for the packet now.
Okay.
And then if we could add agenda item or additional information for agenda item number 8, the coronavirus update. We have CARES Act funding update and CARES Act funding specific to election. And there are written materials that are available for both of those. And then I know we have Sam Lowe on the line as well, who can give the public health update as part of that.
Any others additions or corrections to the agenda? Not, we'll look for a motion for that.
Move as amended, Ludwig.
Second.
I heard Mikrot the loudest, so we'll go with that. The clerk will call the roll.
District 3, Commissioner Chafee.
Aye.
District 4, Commissioner Mikrot.
Aye.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
Then we'll look for approval of the minutes of the June 16th County Board meeting summary for publication, June 29th special meeting, Committee of the Whole. And the minutes, let's see. Do we need, I'm flipping my page here. And then the minutes of the board's reports and for the surveyor monthly report and the board of appeal and equalization minutes of June 15th.
Mr. Chair, you want to do E and F together?
Oh, that's where I got confused. Let's do E first.
Okay. Commissioner Moore will move that.
Thank you.
Chafee, second.
Thank you, Steve. Any discussion? If not, the clerk will call the roll.
District 4, Commissioner McRae.
Aye.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Chafee.
Aye.
Okay, that passes and we'll move on to the minutes under item F. Need a motion for that.
Maker, I'll move them.
Chafee, second.
McRae moves, Chafee seconds. Any discussion? If not, the clerk will call the roll.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Chafee.
Aye.
District 4, Commissioner McRae.
Aye.
Okay, we will move on to the approval of the consent item, including number 4, the new hire.
Ludwig will move it.
Maker, second.
Motion by Ludwig, second by McRae. Any discussion? If not, the clerk will call the roll.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Yes.
District 3, Commissioner Chafee.
Aye.
District 4, Commissioner McRae.
Aye.
District 5, Commissioner Ludwig.
Aye.
Okay, we'll move on to the regular agenda. We have a public hearing for ordinance 2020-43 concerning septic systems. And the first thing we'll do at the public hearing is a presentation of the ordinance by staff. I think we've heard these a few times in our life.
Yes, thank you, Mr. Chair. This is Kelly Schroeder, County Auditor Treasurer. So before you today, you have a septic system ordinance, which is very similar to the ones that you've seen several times this spring and about 10 times in the past. And so what this ordinance does is it allows Pine County to administer septic system regulations in Wilma Township, as they have requested us to do so after the retirement of their inspector.
Questions from the board?
Mr. Chair, I have one.
Yes.
Did you say 10 times? Do we have 10 townships now, Kelly? Or where are we at?
So this will be, since 2014, I think this will be number 16.
Okay, 16.
Yeah, but sometimes we've done combined, like the last one I think had 3 townships on it.
Okay.
And prior to 14, were we doing any townships?
Yes, we had, I think at that point, like 14 of them. And there's 47 jurisdictions. So right now I think we're at all but 7.
Okay. And those are larger jurisdictions that will probably remain for a while?
Some are larger, some are still some smaller ones that want to do it on their own.
Okay. All right. So any other questions from the board? If not, if anybody has joined us on a call in that has some input for us, we'll take it. I hear nobody. And there's nobody in person, is that correct?
That's correct, Mr. Chair.
We will close the public portion of the public hearing and come back to the board for any last minute questions.
Mr. Chair,
Yes,
just a quick question for Kelly. Last time we did 3 and this time 1. Are we appropriately staffed, or at what point are we going to have to add staff, do you think?
Well, at the last county board meeting, you guys actually approved for us to add a support staff in the office. And so with that, and we knew this one was coming when we brought that forward. And so with that, we're feeling pretty good about where we're at for staffing levels.
So that's going to allow somebody else to spend more time in the field?
Correct, yes.
Okay. All right. Thanks, Kelly.
Mr. Chair, I got a question.
yep.
So before a township does this, they have to pay for it themselves. Now, once it comes to the county, is it not free, but does the county pay for it, or how does that work? Or does the township pay the county?
Good question, Josh. So the septic system ordinance, when folks get a septic system permit, obviously it costs the individual property owner. So a lot of these townships, when they were running their own ordinances, just the inspector was directly paid for the permits, and that's what they got paid. Where when it comes to the county, then we like to think that the permit revenue and things like that pays for the position. In reality, it doesn't fully pay for the position, so there is some levy dollars that are in that. But the good news is with picking up some of these other jurisdictions, we are getting, more permit revenue then to help pay for those things.
And I know you don't speak for the townships or know maybe what, but would it be a net, is it financially better for the townships or not better for the townships, I guess?
The township, so it's kind of an interesting question because right now it doesn't cost the townships. It wasn't costing the townships anything to do it because it was all kind of just taken off, the inspectors just took care of it outside of the township budget. Where we ran into problems, or where some of these townships ran into problems, is there is a whole administrative portion that goes along with the administering the ordinance that really wasn't being done. And so then when they're faced with that, then they start to realize that they're not equipped to do it, or they'd have to be paying someone to do that, and it just doesn't really work.
They're not gonna see a big monetary shift in their budget one way or the other.
No, this was all outside their budget to start
Right.
with.
Right. Okay. Any other? If no other questions from the board, we'll look for a motion to adopt the ordinance.
Mr. Chair,
Yes,
I will move ordinance 2020-43. Ludwig.
Moral second.
seconding it, Josh, you're on mute, I think.
Yeah, I'll second it.
Okay, so got a motion by Ludwig, second by Moore. Any other discussion? If not, the clerk will call the roll.
District 2, Commissioner Moore.
Yes.
District 3, Commissioner Chafee.
Aye.
District 4, Commissioner McRae.
Aye.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes. That passes. So thank you, staff, for the work you did on that. Insurance Committee report. Matt, you're gonna be up first on that?
Well, I can try.
Yeah, it's
So
I hope everybody read the minutes of the Insurance Committee because there's a lot of information.
if I can start with the general terms, maybe then we can, if somebody wants to drill down, we can, but we, you know, the insurance committee, we've been meeting periodically, and a few meetings back, I think we reported that we authorized Justin to go out for bids with all options, including self-insuring. So we came back, he came back, and that's what this meeting that you see, this data, is the report on that. So, and we know how it works through Resource, pretty much for everybody here, because we do it all the time. So we had that discussion. It's all based on past claims, and we know that we are spending X amount of dollars to have Resource just manage our account. So it's a fixed cost. So what I'm moving on to now is like the self-insurance part. So we looked at all of it. We have not made a final determination. We're going to come back again and meet sometime in August. But what's interesting is what we basically do is we pay Resource to take the risk and manage our insurance, but Blue Cross Blue Shield still does all the insurance work. So if we look at our fixed costs to Resource, it's over 500,000. It's like 535 or something, just to administer our insurance. So if we decide to insure ourselves, that doesn't mean we're going to save that much money, because we still have to have someone administer. But we would see a savings, because that bid we got from that was included with self-insuring. So like with Blue Cross Blue Shield, we'd save about $140, and if we went through Preferred One, we'd save about $160,000 per year. So that is interesting. So our discussion is around, we stay where we're at, and you know, the market, there's going to be I think it was a 19% increase projected, or do we look harder at self-insuring? So I don't know if you want to add anything there. I kind of hit the generals, Steve, but we haven't really finalized anything yet. And I want to add this too. The committee is a cross-section of the county, and we haven't really voted one way or another in the committee, really. It was just get all the information out.
I think you covered it well. There's a lot of information to digest here for all of our employees and for us. And the cost, the major part of the cost comes out of our budget. And so I think it's something we've looked at the insurance committee. We've talked about it at the board level for a while, is we're always trying to save money on insurance. And so we can save, I think, you know, we have to be lucky as well as good in the first couple of years to fully save the amount of money that we anticipate we can. But I think the bottom line to me is you're either going to pay
Right
the year it happens, because if we pulled the trigger on this and we had very large occurrences in 2021, we would pay that bill in 2021. If we weren't self-insured, we would pay the bill in 2022 because of our increased usage, and our premiums would go up. Our premiums are a direct result of the usage we have. And so if we spend more than, if it costs the insurance company more than our premiums, we're going to pay for that the following year in premium increases. If we have large overages, we're going to pay for them basically in the year that they happen. So I think I've got that straight in my mind.
Mr. Chair.
Commissioner Holland?
Yes.
Yeah, Mr.
Yeah.
Chair. Oh, go ahead, Dave. I want to talk about stop loss. Maybe you're going there too.
Yeah.
So
Oh, sure. I was just going to follow up on what Steve was saying. On the minutes, if you look at the number 2, the renewal projections, that's, I think, exactly the point that Steve was making, that the service co-op would need to have an increase of about 13 or 13.5% because they need $3.7 million to make up for the actual claims this year that we're only paying about $3.3 million for. And so that's the lag, Steve, that you were talking about, that we end up paying for it. And anybody who bids on us is going to look at those exact numbers and say, well, we're going to need at least $3.7 million to insure Pine County.
right.
So to me, if what we're saving is the administrative costs.
Right.
And so if we stayed with Blue Cross Blue Shield, and there's no guarantee we would, but if we did, to the person that is insured through the county, you would still have a Blue Cross card. You went to the doctor, you would see no difference as an end user. I mean, your bill would get paid, your deductible would have to get paid, and Blue Cross Blue Shield would bill the county every month, Kelly, or every 2 weeks or something? It's often anyway.
Every
So
week.
every week, somebody in Kelly's office is going to have to look at that bill and say, yes, this is a legitimate expense, and we got to cut them a check. So from the back room part of it, there is a little bit different scenario how it works. Because in what happens now is somebody else takes care of that direct payment to Blue Cross. If we pay resources, basically. So we're taking on that responsibility. We think that isn't going to be it's not like we have to hire 2 people to take care of that.
No.
It's a pretty nuts and boltsy type of accounting thing that has to happen. So I'm encouraged by it because the more I've come to learn about it, the more I think I've gotten to the point where we can take on this administrative task for a lot less money than we're having it farmed out. And we do a lot of things at the county level that we could farm out, and we've said, we can do that better or more efficiently if we do it ourselves. And I think in my mind, this is no different.
Mr. Chair.
Yeah.
So just for this discussion, Blue Cross Blue Shield would still manage all of the claims, do all
Right.
the things, everything would stay, you said it, everything would stay the same, but they would manage all the paperwork. We would just get a lump sum bill that this is what it cost in this time frame, and we have to pay it. So I think it's like, I look at it like, well, that resource is making money on something because they have a lot of employees. So those are dollars we could save. And I don't know how that all adds up, but to me, we're paying them $535,000 a year, which they buy their stop loss out of that too. But
and we would buy stop loss.
Right.
I mean,
Right.
that we would cover. So any catastrophic, if some employee or their dependent had a $700,000 cancer treatment, it would get paid, and everything above $200,000 would get paid by our stop loss insurance company.
And wasn't
So-
there a max, like even for at the stop loss level, there was a max loss per year too, if I remember right. It didn't go.
Yeah, that's correct, Matt. So that is the 15% number. And so if we had a calculated payment of the $3.7 million and we were self-insured and we purchased that stop loss insurance, which we would do, then our maximum out of pocket is capped at $4.2 million or 15% above. So there's about a $500,000 range above that we would have to have the risk on. And that's the risk today that's with the insurance company.
Which is
Right.
what, Steve, that's what you alluded to, where if we get lucky in that first year, that a lot of that money, well, even the first 2 months because of the lag in payment, like Justin explained, that's in the notes there too. Gives us some dollars in
Right.
savings.
So, I mean, if we start out this thing in the January and February are horrendous amounts of claims, we're gonna be in the hole right off the bat.
Yep.
I mean, it could happen. So we have to go in with both eyes open.
Yep.
It could, the other thing could happen and we could have a really good first quarter. So we build up a cushion. We can't bank on that, but we can hope for that. And we bank on the average, just like the insurance companies bank on the average. And they have a calculation and our consultant, Justin, does all those calculations for us and gives us a realistic figure that says this is what your premium would be. And this is what you should set aside every month or every week as payments that you know you're going to have to make. $3.7 million is a lot of money. I mean, there's just no getting around it, but that's what our premium will be.
Yeah,
It's
and
it's a cost of us doing business. It's what we want to provide for our employees. We've worked on this for years to make our employees comfortable with their insurance. You know, it is insurance costs. We can get as mad as we want to at the insurance companies, but it's a reflection of what healthcare costs. And so the best we can do is figure out how we can manage that bill most efficiently.
Mr. Chair.
Yes.
Yeah, and I think you nailed it right there, because those dollars are levy dollars. And
Right.
I think it's our responsibility to try to figure out a way to get the most bang for the buck, because we're levying those dollars. And if we can figure out a way that we can turn it into, even if we're saving $50,000 a year, it's a lot of levy dollars.
Right.
And hopefully we save a lot more and then get that cushion built up. So I think there's room for a lot of discussion in that plan. I'm not ready to jump in yet, but I think I understand. I'm starting to understand it a little bit.
I hope if there are questions from any of the board members or employees, but right now we're dealing with the board, please ask. Ask David, ask Matt, ask myself. If we can't get the answer, we'll have you talk directly to Justin, because it's a big decision. But there's a lot of balls in the air all the time, so to speak, with insurance, and this is a formula I think that is really worth considering. So we have to decide one way or the other. What's our drop dead date, David? In about 6 weeks?
Yeah, we'll be getting our renewal in August from the co-op. And so we'd have to be prepared to make a decision to go that direction, to go out independently and get a fully insured bid, or to go out as a self-insured pool.
So now is the time to ask those questions, because we're gonna come back and there's gonna be a question before us in the next 6 weeks, I would think, about which direction we want to go.
Mr. Chair, I got a question.
Yes, yeah.
What does the staff think of it?
What is the what?
What does the staff think of this, though, that's on the insurance committee? Because I see there's some staff members. Are they for it or against it or neutral or?
I think they're all over the board, Josh. We haven't taken a straw poll or any kind of a poll. And I think that committee has a lot of smart people on it. And they've been gathering their information and probably coming to their own conclusions. But we have not had any kind of a vote whatsoever on what people are willing or want to do.
We did, Mr. Chair, we
Yeah.
did get some feedback before Justin started to do the research on self-insurance.
Yeah.
And I think all but like one or two of the employees on the committee were interested in exploring, which is different than deciding that after reviewing the information, that's the direction you want to go. But we did start down the path with, I think, a lot of folks interested in trying to answer really the same questions that the board is struggling with. What's the best way to offer insurance?
One other quick question I got is, do we know any other organizations, counties, cities, whatever, similar size of us employee-wise that do self-insure or that do this, that are horror stories or good stories or anything like that, I guess?
We had, good question, Josh. We have been following that, and Justin does have a quite an extensive list of counties similar in size, cities with similar amounts of employees, and then also a list of bigger and smaller. When you get too small, it's not even an option for you, because the risk is too high that, you could have, if you only got 15 or 20 employees, there's that volatile risk. But when you got 250 and basically 1,000 people on the insurance plan, it kind of flattens that risk out. So, but our neighbors to the north are in a similar, are they about that same? They've been exploring it longer, but they haven't pulled the trigger on it yet either in Carlton County. I believe, is it Cass County that has done it for a while? And
I think Cass is one that has. And I think in the discussion, I think it's always important to come back to the idea that the county's costs are the county's costs, right? We're not going to have a big increase on one and a decrease on the other. However we do it, it's going to, if our costs are going up, they're going to go up across the board. And self-insurance saves a little on the admin piece, but one of the primary goals is to get that rate consistency, where from year to year to year, we're not getting a 13 or 15% increase and then a 2% increase the next year, that we have better predictability.
Mr. Chair.
yes,
And when we also had, or Justin posed that we could, just for the stop loss portion, we could pool with other counties that are doing it and lower premiums. And he didn't go very in depth in that, but he said it's possible. Just that's it. Our insurance would be separate, but just the stop loss portions we can pool with other counties. And I thought that was kind of interesting also. I don't know what it all meant, but.
yeah, that was an interesting concept.
Yeah.
Yeah, and I think, Matt, I'm sorry, I was just going to finish up, Matt. I think it's as simple as that. On the reinsurance level, you could partner with somebody, and rather than have like 200 or 220 contracts, the number that Pine has, you might get 500 contracts or a bigger number. And so then you're more attractive on the reinsurance piece, but it would not change the individual insurance that each county would have. And so you could have differences at the individual insurance level. It would just be at the stop loss level that there could be some pooling.
Right.
You wouldn't lose your autonomy in doing that.
Right.
Any other questions? We'll keep you informed and let you know what's going on, certainly. If not, we'll move on to the Technology Committee report. Josh and I were there. Josh, do you want to lead that one off?
Sure. So yeah, we did meet. We talked a lot about, well, I don't know if we talked a lot, but anyways, IT staffing came up with everything that's been happening. And with what a wonderful job our IT department has been doing, they have been stretched. So we did discuss adding an IT staff person. And we did, the consensus of a committee was to add an IT position. I think it was going to head over to personnel. But part of the deals that they got going on is everything with this, with what's been happening. They're getting a lot of extra phone calls, and because so many more people are on technology at home, so they have issues there. So they're calling. It's not just the courthouse, or all the county facilities are pretty good to go as far as just the little internet problems and this and that. So that was kind of part of the big deal there. Also, we talked about the CARES Act funding. What are some stuff that can be covered under that funding, and projects that they got going forward? So they're going to try to get some of them done. Some of it that's already been done that can get funded through the CARES Act, and some potential stuff that is related that we can get done before the funding goes away. And then we did have a brief discussion on what data is accessible by the Beacon website. So I think that's about it. If you got anything else to add.
No, but I would like to just expand a little bit on the data requests that for Beacon. I don't know how many of you guys go on Beacon and look at your land or some neighbor's land or whatever you look on there for. But apparently we get requests for individuals to, if you went and looked at the 80 next to mine and you, it shows who the landowner is. And apparently people don't want that to show up. And I have a hard time understanding why, because you can get the neighbor's address and phone number by Google searching a million different ways other than on Beacon. So I don't know. It seems like those requests would fall on kind of deaf ears on my part, but maybe I need more education on it. But Kelly, do you want to explain any more about that?
No, I think that's good unless there's questions.
Okay. If you have questions on that, ask Kelly or myself or David, and we'll see where that goes. I think we're okay where we're at for now. Anyway, any other questions on the Technology Committee? If not, we'll move on to the Initiative Foundation. We have Carl Newbanks with us. I gotta find him on my screen here again. There he is. Carl, you wanna give us some words of wisdom?
Yeah, well, I don't know about words of wisdom, but I can give a little update anyway.
Good.
Mr. Chair, thanks for letting me join the meeting today, and commissioners, thanks for letting me jump on for a couple minutes. My name is Carl Newbanks, Grants and Development Manager for the Initiative Foundation, and I should apologize. I'm not exactly sure if our materials made it to you for you to have in front of you. So I can.
Carl, they do have in their packet the information that you sent or that was sent.
Oh, perfect. So the first page there is our Pine County kind of statistics update, the one with the kind of picture of Minnesota, and it shows the 14 counties there. $725,000 in donations collected from Pine County over the years, with a little over $4 million investment back into Pine County from the Initiative Foundation, which leaves us at a return on investment of $5.55 back into Pine County for every dollar that we've collected out of Pine County, if that makes sense. Of course, this is all statistics from 1986, from the day the foundation started, with a total of 286 grants totaling 1.4 million, 44 loans, 2.26 million, created or retaining 605 jobs, and leveraging 11.5 million in outside capital. And currently, I think we have one active fund in Pine County, the Greater Pine Area Endowment, which is a nice fund, a good board, active folks doing lots of good grant making across the region right now. And then the back of that same sheet where it says investment highlights is just a real quick glance at a few recent grants, where some of the business financing has gone, again, listing the Greater Pine Area Endowment. We've had a few nonprofits in the region come through nonprofit training recently, and then just some little brief narrative highlights at the bottom about some of the activities that have been going on in Pine County as well. And then I thought I might just show one other sheet, and then I could give a few COVID-19 updates as well. But I think you also have the sheet that says projects funded in Pine County, 2018 through 2020. And again, this is just a quick glance, only through March 30th of 2020. So we've had, if you can imagine, we've had quite a bit of grant activity since then related to COVID-19. But so you can see some of the more recent grants from the Greater Pine Area Endowment and our own innovation funds. And then again, some of the business lending activity just within the last, really this sheet just covers 2018, 19, and the first quarter of 2020 as well there. So I don't know if anybody has any questions of any of that. I can go into some COVID-19 updates and give you some more specific stats related to our grant making, if that's okay, if no one has any questions about these more general statistics here that we usually kick out when we do a meeting like this.
Sounds good.
Okay. I would say we go back to our COVID-19 update page that you have in front of you. Again, there's a few updates on this. This was, I think, June 1st of 2020. Our Regional Emergency Relief and Recovery Fund, it kicked out $153,500 in emergency relief grants. That is to food, shelter, basic services, and regional nonprofits. Trying to get to my notes here. So of that 153,000, there was 111 grants for COVID-19 relief and recovery. 5 of those grants were in Pine County for a total of $14,500. The next bullet point there talks about, Governor Walz requested that the Initiative Foundations create funds to provide child care support for child care agencies or businesses or home cares that were providing support for children of essential workers. And so we did spin up a fund for $150,000 to do that. And of those grants to support childcare for essential workers, there were 7 grants in Pine County for a total of about $9,500 this year as well. We did deploy $1.2 million in emergency loans to 56 small businesses. I don't believe any of those emergency loans went to businesses in Pine County, though. I did ask our lending folks if they had data about if folks from Pine County had applied, and they could not pull that data together for me. I only thought to ask them for that just yesterday. I apologize for not having information about whether or not folks in Pine County reached out to us for that emergency lending. The next line down, local emergency relief funds hosted by the Initiative Foundation. We've distributed over $250,000 region-wide. The Greater Pine Area Endowment has distributed 4 relief grants for COVID-19 worth about $6,000 in Pine County. And in all of 2019 and 2020, they've released a total of 6 grants for $11,500. That does include the $6,000 for COVID-19 relief. I'm not sure if you guys would be aware of it. The Greater Pine Area Endowment made a really neat grant to a local business that started manufacturing these little plastic holders that go around the back of your head that hold your face mask together so it doesn't hang on your ear. It was a really neat project and had a lot of Facebook traffic and such. And it was just, I think, a great example of how a local relief fund can kind of be there to just make even a small grant. I think they purchased the 3D printer for this local, I think it was a computer repair business. So, and they just kind of shifted their business from computer repair to printing and selling some of these items that were more specifically related to COVID-19. And then I think they adapted to face shields, et cetera. It was kind of just a neat way that a local fund, a local relief fund can shift their gears really quick and provide really neat service to the communities. So we were happy to be a part of that project as well. And then just to give a little bit more of an update related to grants, total grants going into Pine County for 2019 and 2020 so far have been 22 grants for $89,000 and an additional 5 grants that were more regional in nature impacting Pine County for additional $14,000, so a total $103,000 into Pine County in grants for 2019 and 20. Again, just to break that down, about 5 emergency relief grants for $14,000, 7 emergency relief for child care provider grants for $9,500. Of course, the $11,500 for the Greater Pine Area Endowment and their grants, and then 9 grants from the Initiative Foundation's Innovation Fund for $67,000. Total all that up, you get to $103,000 in grants into Pine County. Notable grantees, the City of Pine City. I think we granted for outdoor rink improvements, Central Lakes College, high fidelity simulation equipment. And of course, some of your nonprofits in the region are Place for You, New Pathways, Pine City Area History Association were kind of a few notable grants that we were able to provide into the region this year. I would say 2 additional upcoming projects. I know that we are distributing the new deed business recovery grants. They're $10,000 grants. We expect to distribute about 800 of them in the region. They are lottery style awards from the state, and so we really won't have any control over who gets them or who doesn't, but we will be distributing, we estimate about 800 $10,000 grants to businesses across the 14 counties. And we do expect additional money from the Minnesota Department of Education to continue to support childcare programs that were impacted by COVID-19. I think part of the concern is a lot of our childcare programs have kind of spooled down what they can provide or even closed. And so as the economy reopens, we're going to need to get some of those childcare providers back up and running so we can provide childcare for all of our employees, et cetera. And we're partnering with many counties to provide, to host grant funds or relief funds and lots of different ways and of lots of different capacities. And we're always would love to work with Pine County in any way that you guys feel we could serve you as you collect funds and want to distribute them to needs across your region as well. I think Sherburne County, we're hosting a grant fund with them to provide resources for businesses as they provide outdoor seating. And so businesses apply to them and we just kind of help grant the funds and get the money out the door as well. So always happy to work with everybody in any capacity as that you feel like we can serve you. And I think our current ask for Pine County would be $7,450 in the 2021 budget. So I'd be happy to answer any questions anybody might have related to all that. Sorry to dump so much data on you.
Anybody have any questions? You could do such a nice job, you know, you cover the waterfront really well.
Thank you.
We have seen the work the Initiative Foundation has. I think every one of us, in some way, shape, or form, what has happened in Pine County. So we're very pleased with the work that has gone on here. So thanks for keeping us in mind all the time.
Absolutely. We're happy to continue to do anything we can. So don't hesitate to let us know. One other thing we always like, oh, go ahead, Mr. Chair.
I do think we will be leaning on you for these CARES Act dollars and how we're going to get those distributed to businesses, because it's a head scratcher for me. But you folks are kind of used to doing it, so maybe you can lend us a hand.
Absolutely. Love to help.
Well, thank you.
Yeah. Thank you. And don't hesitate to reach out again for help or to give us any input. If we're missing something or something that we need to pay more attention to, please reach out and let us know. We always love the input as well. So.
Thank you, Carl.
Yep. Thanks again, everyone.
Yep. We're looking at amendment to the joint powers agreement with the Minnesota Department of Corrections. Rod, do you have anything you wanted to add to that?
Sure, Mr. Chair. Yeah, Mr. Chair and members of the board, it's not really an amendment. It's just a continuation, I guess, of our work release program through the Department of Corrections. It's an updated contract, like that. A couple points I wanted to bring were it's $60 a day. It went from 50. The history was $50, went to 55, and now they're paying $60 a day. And they added a component in there for GPS monitoring for an additional $21.12 a day per offender if they were on a phase 2 electronic monitoring. I do want to just clarify that at this point, we aren't really participating too much. We don't have people going in and out of our jail at this point. So we do want the contract in place should we reopen that piece. And in another part to that is we do have a couple that are here as Huber work, or not Huber, but work release program through the DOC. It's just they were already here. We're getting paid for them. They're just not going out to work. So my request would be is to continue the contract for another year. Should we be able to accommodate that and open up the doors and allow people to continue working? Any questions? Yep.
No, thank you. I would assume we need a motion on this.
That's correct.
Okay. And Matt, were you making the motion? I saw your
Yes,
lips moving.
Ludwig will move that.
Okay.
Moore will second.
We got a motion by Ludwig, seconded by Moore. Any discussion, questions? If not, the clerk will call the roll.
District 3, Commissioner Chafee.
Aye.
District 4, Commissioner McRae. District 4, Commissioner Vickert.
They must have muted themselves and left. He's pointing, he's giving us the
He's giving a
thumbs
thumbs up.
sign.
Okay, thank you. District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes,
District 2, Commissioner Moore.
Yes.
Thank you.
all right. We will move on to the Nemadji One Watershed, One Plan, the draft plan, Matt. Or Caleb, who's gonna take this? Caleb?
I can take, oh, Caleb can take it. He's good at it.
Whatever you like, sir. Yeah, so we're very excited to have a draft of the Nemadji One Watershed, One Plan. It's the group has worked pretty hard on it, and we've been working with a great consultant. So we've got a draft plan. You were provided a link to that. And similar with how we handled the Lower St. Croix, our next step is to put it out for a 60-day review period from the state agencies, other folks as well, but primarily state agencies are who will be commenting. So having been giving that draft, if we're requesting if you have any comments or feedback for Matt that Matt should take back to that policy committee, we would welcome that. And if not, we would be looking for a formal motion for Matt to vote affirmatively to submit the plan for 60-day review at the next policy committee meeting.
You're muted.
So we need a motion from this board to give Matt the authority.
Correct.
Chafee will move that.
Moore will second.
Chafee moves, Moore seconds. To give Matt the authority to vote affirmative on the Watershed, One Plan. I would say you guys moved at record speed. I commend you. That's awesome. I did look through the plan, but I get lost in all of that stuff, to tell you the truth. But from what I could understand, it looked like you did yeoman's work. Anyway, any more discussion? If not, the clerk will call the roll.
District 4, Commissioner Mickert.
Aye.
District 5, Commissioner Ludwig. District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Yes.
District 3, Commissioner Chafee.
Aye.
You.
Okay, we'll move on to award contract number 2001. Mark, you gonna handle that?
Yeah, thank you, Chairman. We opened bids yesterday, had 5 bidders, which was nice. That's a real good bid. Sometimes this time of year, we hit it pretty good about their schedule. These 3 projects, there's 2 timber structures and an old beam structure on 150. So one's just west of the Bible camp on 27. The other one's just east of the Fleming Logging Road on 30. And then the 150 is just west of 40 up there. We had water backing up there for some of those big storms, so it'd be nice to get that replaced. So I'd recommend awarding to Midwest Contracting for $963,059.50.
All right, somebody want to make that motion?
Moore will move it.
I'll second.
Got a motion by Moore, second by McRae to award the contract to Midwest Contracting. Debbie got the amount because I couldn't write fast enough. I gotta wait for a cuckoo clock to get done. Any discussion? If not, the clerk will call the roll.
District 5, Commissioner Ludwig.
Matt?
Aye.
Okay,
Thank you. District 1, Chair Holland.
yes.
District 2, Commissioner Moore.
Aye.
District 3, Commissioner Shapey.
Aye.
District 4, Commissioner McRae.
Aye.
Thank you.
Thank you. Mark, how are the other projects, like Main Street through Pine City, is that out for bid now?
Yeah, we'll be awarding them at the next meeting. So that'll be August and September group. So there'll be projects down here and there'll be the projects up north, all in one contract.
Okay, sounds good.
Yep.
Coronavirus response update. Sam, are you gonna be first on that? And then we'll go into the CARES Act funding stuff.
I can.
Okay,
So I don't have a beautiful PowerPoint for you today, mostly because the PowerPoint would be basically the same as last week. Pretty much everything I said last week still holds true. We are seeing, so I did mention last week that Minnesota as a whole is doing better than most other states, and that we were seeing a kind of with these little blips. We are starting to see Minnesota as a whole trend upwards again. So today they literally just posted a minute ago that we had the highest number since the past couple weeks, I want to say, of 569 new cases today. So we're just seeing the slow tick back up. So it's not a huge sudden influx like Florida or Texas, but we're trending backward. We're back up a little bit. And as long as it stays that manageable level of cases with those little blips, that's okay. We just want to avoid these huge spikes that we're seeing down south. Pine County as a whole, we are just in the manageable slow trickle of cases in, couple cases a day, then no cases the next day, just slowly rolling in. And they're all over the board in terms of, you know, a healthcare worker and people who travel, people who didn't travel. So there's no real consistency there. But people are doing a good job of answering the calls, usually when we call, calling us back, so that we can connect with them, talk them through their quarantine and isolation and get their contacts so we can connect with them and have them quarantined. So that's going really well. Pretty much everything at the national level is the same in terms of we're having these hot spots down south. It's not great. They are rolling back. They haven't gone backwards yet. States are very hesitant to go backwards in terms of restrictions, but they've paused the reopening at least. So they're not increasing capacity of, you know, restaurants or movie theaters, but they're very hesitant to go backwards. That politically just isn't very palatable. And I think I mentioned last week that the EU was looking at restricting travel from the US, and they did do that. So if you want to travel to Europe right now, you won't be able to, because we are the hotspot of the world for this. Those are kind of there's not a lot of other big fun news changes. We're trucking along still. The CARES Act knowledge is the more exciting pieces of information.
I don't know if you call it exciting, but it
That's
might
a lot
be
of dollars getting
challenging.
It's a lot of
Thanks,
dollars
Sam.
into our community. Yeah.
Thank you. David, do you want to start us off on the CARES Act funding?
I do, thank you.
Yes.
So we have received or will receive soon our allocation. And that allocation is $3.6 million. Cities and townships of 200 and above receive a direct allocation. And so respectively, the cities are going to receive 880,000 and the townships 424,000. And so the total for all of Pine County is almost $5 million. It's $4.9 million. So it's a lot of money. And then the big question that we have to answer is what will be done with those funds. And so it all comes from the Federal CARES Act. The act outlined 3 requirements to spend the money. Number 1, the costs are necessary and due to the public health emergency. Number 2, that the costs are unaccounted for in the agency's budget, or the costs are substantially different than what was in the budget. So for example, with public health, there may be a public health educator who is focused on tobacco or alcohol education and is now working on the response to the coronavirus. Even though that employee's wages were in the budget, the work is substantially different now and related to the coronavirus. So those wages could be covered with these funds. And then the third piece is they have to be incurred, the costs have to be incurred between March 1st and December 1st, 2020. So anything before that or anything after that is ineligible. Kind of a laundry list of things we can fund for the organization are the engineering changes that we made with plexiglass and things like that, hand sanitizer. If we have someone out due to the coronavirus on workers' comp, those costs are covered. Some of the technology that was talked about at the technology committee to make telework work for people, those costs are covered. The funds also can be used for community recovery costs, and these are a little less clear at this point, but literally we get guidance every day on what those can be used for. But things like grants to small businesses to reimburse business loss, grants to prevent eviction, and assistance for rent or mortgage payments. So we have had 2 video conferences with a group representing some of the cities in the county to talk about a coordinated response. There seems to be a consensus, at least among the larger jurisdictions that we've been talking to, that there should be one, if you're a business or a community agency, there should be one point of entrance, one application that you would fill out. And so we're working towards that. We have Leslie Sauter is from the City of Pine City. She's the Community Development Director. She is coordinating the grant application process and criteria, and that work group's first meeting is this Thursday. So to help think about how we might allocate the money, I put together a chart that should have been sent out as additional information in your packet that tried to take that $3.9 million, or excuse me, $3.6 million number and divide it up among some potential uses. And so if it's helpful, right, there's Pine County, obviously. We have $54,000 for the very small jurisdictions below 200 that we need to reserve, or at least give them the opportunity to apply for. I've included some money for business assistance, family pathways for food support, Lakes and Pines for housing support. And then there's a line in there for assistance to community support organizations. These would be some nonprofits that might qualify. And then there's an HHS direct assistance line. I know Becky has been having conversations with veterans, the Veterans Office regarding assistance to veterans. There might be some other things that we would want to do direct assistance for. And then I included broadband. There's no dollar amount there because it's so undefined at this point. But there is the potential that some of the money could be used to extend broadband or expand broadband. Of course, one of the challenges with that is anything that's done construction-wise would need to be done by December 1st. So is that framework helpful, Steve, for commissioners to start to think about how they would want to allocate funding?
I think it's always helpful, David, to have some framework, because then we can say, how come this wasn't included, or why is that included? So we got something to throw darts at. But my one question, I like the framework. I think places like Lakes and Pines and Family Pathways are big partners of ours. But the food support, somebody should check with Council on Aging, because there's been a huge demand in home delivered meals. And I don't think their money, unless they get another big supplemental budget increase, their money is not going to hold out. I mean, with the huge food support requests they've had. And I don't know, maybe they got a big, or are anticipating a big new supply of money too to take care of the increase, but the increases have been exponential in home delivered meals. Becky, I do have a question for you. The direct assistant HHS, have there been a lot of people looking for more assistance?
Thank you, Mr. Chair. So what I am hearing from my group is there's a lot of need for food. And I think there is big concern whenever you have a big event like a pandemic or something huge like this. There's a lot of support initially. We are very concerned about what's going to happen in August, September, October, and November. If certain things are lifted, if the federal peacetime emergency is expired, or if other things happen with the moratorium on evictions, that's just a real concern. There's been extra support given for food for now, but I think people are genuinely concerned about August, September, October, November. And I would say too, with the unemployment rate in Pine County and just how COVID is impacting people in different ways, we're learning every day a new experience somebody is having. It might be a foster parent, it might be a daycare provider, but now they're under quarantine. They can't have their business operating the same way that they did before. So really making sure that we're reaching out to people individually that we know and assisting them in some way is very helpful to them.
Mr. Chair.
Thanks, Becky, and yes, Matt.
Mr. Chair.
Yes.
So I have a follow-up, Becky. So you said there was an increase for food. Was that an increase in new people, or just an increase in people you're already caring for? Clients.
Right. I'm not even, I guess I'm not even specifically talking about numbers. I'm talking about just what we're seeing in the community for an increased need for food due to food insecurity. Okay. And so I hope that makes sense. We're seeing it that way. And
yeah.
as an example too, with Mindy, with the work that she's doing in the Veteran Services Office, she is referring people over to the economic assistance programs, but sometimes it takes a week or longer to get approved for that assistance, just depending. And so if we can help support veterans between point A and point B, that's very helpful to her and the work that she's doing.
Yeah, the supply chain side is slow everywhere, and the volume is different.
Becky and Sam, probably one of you know the answer to this, but I'm concerned about our elderly people that need doctor care, and it's seemingly very difficult to sometimes get to see a doctor for routine things. So have you seen that, witnessed that? Is there a way to help those people? I kind of get this feeling, you know, you can get by so long without doing anything. And then if you are in need of doctor's care, and then all of a sudden you get to that point where you can't get by anymore.
Right. No, and that was a concern, especially a month or so ago and previous before then when everything was down. I have heard that most facilities have brought back the majority of their staff. So Essentia's brought back most of their nurses and their physicians and all that in order to provide that non-emergent care. So just the standard preventative care, checkups, whatnot, should be easier to get into now. I know they are, like, some pediatricians' offices, and this is more in the cities that I've heard about it, have, you know, certain clinics are sick clinics where you go there if you're sick, and if you have a well child check or things like that, you go to a different site within the same system. So it might be more logistically challenging, but it's just how they're trying to set it up to keep people safe. But theoretically, it should be easier to get into a physician now. But there might be a backlog now because everybody's trying to get in to see them after 3 months of not being able to get in. So there might just be a delay in the schedule.
I'm just concerned because we have limited facilities sometimes and in Pine County, you know, if you're in Pine City, either go to Fairview or Wellia, and if they're not able to see the normal amount of patients, where are those people going to go? They can't get anyplace else. If you're in Hinckley, I've heard that clinic is only taking certain, you know, if you need therapy, you can't go there. So how do they get to the nearest therapy place?
And I know a lot of different providers are trying to be creative around telehealth and, you know, phone visits. But of course that assumes that you have, you know, either internet access or service where you live. But they are trying to be creative to make themselves more accessible, but it's definitely a work in progress.
Okay. Thank you.
Mr. Chair?
Go ahead, Steve.
Yeah, and I had to step out for a minute, so I didn't quite get that. You said something about services at Hinckley. Just to FYI, the clinic at Hinckley is open. We have services are available.
Okay. That's good. So David, what is our next step with this distribution of $3.6 million? I get where what costs we have incurred and think we're going to occur in townships, and Lakes and Pines and Family Pathways, but the business assistant grant part, how are we going to figure that one out?
So on the business assistance grant part, we have a work group that is meeting on Thursday that includes Don Hickman from the Initiative Foundation, as well as representatives from a number of the cities in Pine County. And the idea is that work group is going to come up with some criteria that we would want to apply. You know, how big would the grants be? What types of businesses do we want to support? How would we measure the impact? Would it be a loss of revenue? And a lot of that in my mind is just not in my mind, right? I'm not exactly sure how we would articulate that. And so we'll be getting some guidance from others who have done this, because some other larger jurisdictions already have these programs. So our next step is Commissioners Moore and Mickret are the committee that is oversighting this for the county. So we'll work with them over the next 2 weeks. And then I anticipate at the July 21st board meeting, we would have some more specificity, or at least a phase 1 action plan that we could look to get some direction from commissioners on.
Thank you. It's becoming more clear to me.
And maybe the other point that I'll make is it's unclear under the federal or state guidelines exactly what county boards have to decide. So if you, as a county board, said, accept these funds and spend them in accordance with the law and left it at that, legally, I think that's sufficient and we could develop a program. So to me, that seems like a little too little involvement of the commissioners. The other extreme is commissioners would be reviewing every grant application. And that seems like too much involvement. So I think we're trying to find that middle ground that says the county board would allocate funding based on different areas. And then they would, give approval of the process to distribute the money. So you would say, yep, we like that grant application and we like those criteria. And then there'd be a separate group that would review those and then make those awards.
Yes, thank you, David.
Mr. Chair?
Yes.
Mr. Chair.
Yeah.
So, I know it's new, David, but how do you figure out the priority?
I think you get community feedback. And so our county administrators, Kathy George in Sandstone, Kyle Morrell in Hinckley, and Matthew Van Steenwick and Leslie Sauter in Pine City, and Nicole from Finlayson, they have done some outreach to their business communities saying, what are your needs? What are your priorities? How can this money help you? And so they're on the work group, or some of them are on the work group that's going to make the criteria. And so when you ask the question, how do we know the priorities? We're asking for feedback. And so if you know business owners or nonprofit folks who have thoughts or ideas, certainly you can pass their feedback on, or you can, send them my way or to any of the city administrators, and they'll be collecting that feedback. And the Becky Schuler from the Pine City Area Chamber is on our work group, also as a representative of the business community.
Okay, thank you.
Well, you guys got your work cut out for you, that is for certain. I'm kind of glad I'm not on that committee. But the election part of it, what do we need to do here?
So, Mr. Chair, members of the board, this is Kelly, County Auditor Treasurer. So separate of the regular CARES Act funding that David's been talking about, there is a separate pot that is specifically for elections. And so for Pine County, that's a total of $29,607.74. And so in order to receive that, we have to pass a resolution to accept those funds. So you have before you today the request to authorize the chair and the county administrator to sign a resolution authorizing the acceptance of those funds. And so what those funds will be used for is a portion of them will go to the cities and townships that have polling places in order for them to purchase whatever items they need to ensure the safety of both their election judges and the voters at the polling places. And then a portion of that will be kept by the county in order to do those same things. And so you have the request before you today, and then it's going to be a lot of coordinating that's going to be involved with those townships. One thing that we discussed with them already last week when we were at an election judge training is that a lot of them would like those kind of freestanding plexiglass screens. And in getting pricey for those, if we just place a bulk order, they would be a lot cheaper than if each township ordered their 3 that they need. So it's going to be a lot of coordinating, because rather than sending the townships that portion of their money, I would like to just purchase those and things like that. So it's lots of work to do. CARES money has a lot of attachments to it. And same with the regular CARES funding. Any of these funds that are not spent after the November election, we do have to return.
Do you have any sense, Kelly, that $29,000 is going to cover that amount of work that has to be done?
So my answer is, I think that it's more than enough.
Okay.
Because the state emergency management is supplying mass hand sanitizer and disinfectant already to every polling place. And so that seems like a lot of money when you're really the only other thing that we can really think of purchasing is plexiglass, and the quote on that is just right over $11,000.
Okay.
So I think we're going to be pretty well covered.
Okay. Thank you. So we need a motion to, am I missing the resolution number?
Resolution 2020-45, accepting that election specific dollars.
Okay. I need a
Morrow
motion.
move that.
More
Ludwig will
moves it.
second.
Who seconded it?
Ludwig.
Ludwig seconds. Any discussion? If not, the clerk will call the roll. Where'd the clerk go?
She's muted.
District 1, Chair Holland.
Yes.
District 2, Commissioner Moore.
Yes.
District 3, Commissioner Shafee.
Aye.
District 4, Commissioner Mickert.
Aye.
District 5, Commissioner Ludwig.
Aye.
Thank you.
Okay. We'll move on to commissioner updates. Meeting with Representative Nathan Nelson. Who wants to update us on that? It seems like months ago.
It does. I think that was you and Becky and me, Steve. So if you want to.
I'm racking my brain here. I think we had a good meeting. I appreciate Representative Nelson taking the time to come and understand what happens in St. Paul and how it relates to what we're doing in Pine County. He's been a very good listener, and I think a good advocate for us. I think he's got a good grasp of the challenges that we have faced here. And one of the big focuses of our efforts this spring has been to educate legislators for these waivers, so that one day the emergency is going to end, and the next day we got to go back to the way it was prior to the pandemic. So we have relied heavily on those waivers, and so I think the message got through to legislators because they have extended that those waivers 60 days past whenever the emergency ends. And then many of the waivers are extended to next June 29th. Is that correct, Becky?
Close, June 30th.
June 30th. Okay. I was off a day. But anyway, I think the Blue Ribbon Committee at AMC did a wonderful job of targeting legislators, and it's just a matter of education, I think. And we did a wonderful job, I think. Becky really put together a nice, understandable, written up thing about what those waivers are meaning to us, and specifically how they affect families and how they affect her workers. And so I think that's when people understand what this means and how we can be more efficient, we're hoping through this whole process that some of these waivers don't become waivers anymore. They just become the way we do business forever, because they just, in my mind, there's just a lot of no-brainers that over time, people have thought this is a good idea, and so they put these waivers in place and never had any understanding of what it did to the people working in a little HHS shop in Pine County, and how it affected us. And some of them truly are a carryover from the days before we had anything called cell phones and the internet. So these ability to check on people and not have to see them face to face has actually become something now that is much better, we're finding out. So I think there's some good things that have come out of it. Anything else we talked about? If not, the AMC Blue Ribbon Committee, I mentioned that we actually, when the special session got over, we took a 2-week hiatus, and we're going back to work again tomorrow. So we'll have more to report after that. But our focus truly was getting legislators to understand the importance of this waiver and what a big difference that has made. And I think we accomplished, it was a huge, I don't know if you call these wins even. I think it was just a huge over the edge thing that we got on the same wavelength with a lot of legislators and a lot of people at DHS and a lot of county workers. Finally all sat down and said, hey, some of this stuff just makes too much sense to let this opportunity go by. So I feel good about that. Snake River Valley Watershed, you guys meet, Josh?
They did cancel it.
Okay. Shack meeting?
Yeah, is Samantha still there?
Yep.
Okay, I tried to access that of the information they gave us on my mobile phone, and I couldn't access it. So I hope that Samantha did.
I'm trying to get my children to go away. No, I was at the Shack meeting. I successfully got into it. And it was sorry. Worst timing ever. First they interrupt me now. Yeah, that meeting was interesting. It had the governor at one point, and he talked about, because this was pre the CARES Act dollars being distributed by him, and so he talked about the push that he's going to make to do that and the struggles they had with the legislature to get anything done in the special session. So that was kind of the interesting part of the conversation. And then it was just less exciting.
Sam, this is Mr. Chafee. How did you access that meeting?
It was just a WebEx, I think. It was just.
Yeah, see, I was doing the mobile phone and I couldn't get in, so I don't know what was the deal. So anyway, sorry.
Oh, yeah. Good. Yeah, let me know next time and I can see if I can help you troubleshoot if it doesn't work again.
Okay.
Thank you. Regional Development Commission. John, were you at that? Did they have a meeting?
Yeah, I was able to get in with that one. The East Central Regional Development Committee, they were invited to apply for 2 non-competitive grants from EDA under the CARES Act also. One of the grants is up to $400,000 to conduct planning and coordination activities to respond to the economic injuries as a result of the pandemic. The other is to capitalize a $500,000 revolving loan fund to help businesses have been affected by the pandemic. Both grants are to be used up within a 24-month period. Other than that, we had reappointments. We had 6 board members. The term expired. All 6 showed interest and were reappointed again for another 2 years. All loans are going well. One was paid off early here a week or 2 ago, so the little fellas are making it one way or the other. They're paying their loans, so we're happy. That's about it.
Good. Thanks, John.
You bet.
Let's see. NLX was canceled. Facilities was canceled. One watershed, one plan. The MAGI was, I think, you got anything else to report there, Matt?
That was canceled.
Okay. We did have a Lower St. Croix meeting that somehow I had it on my calendar as the wrong day. So as I'm trying to dial in and nobody's answering, I finally realized that I'd missed it by a couple of days. So I'm sorry about that. But nothing earth-shattering apparently happened because no frantic calls were made to me that they needed my vote one way or the other. So anyway. Any other meetings we need to know about? If not, we've got the upcoming meeting schedule before us. Once again, want to thank our outstanding staff for all the, I know it hasn't been easy for you folks. It's hard enough to do the job on under normal circumstances, but I think you guys have done extremely well, and I'm very proud of everybody that works at Pine County. You're all awesome. So keep up the good work. With that, I believe there's no other business to come before the board, and we'll declare the meeting adjourned. Thank you.